In this short video, I'm going to demonstrate a nice example of small cell melanoma, which was very kindly shared with me by Antonina Kalmykova of CSD Health Care in Kyiv. Small cell melanoma is a very rare variant of melanoma, and its importance is that it can be easily misdiagnosed as a number of other tumors, which I'll come to in a short PowerPoint presentation, which is included in this video. It's called small cell melanoma, obviously, because it's composed of small cells, and as you'll see, it is similar to nevoid melanoma, but differs from it by the size of the cells and the morphology of the cells. Now, this is a case for which I have no clinical information other than it's obviously at an acral site due to the very thick stratum corneum, and I imagine it's probably from an older patient, so that would be a reasonable background. Now, when we look at the lesion, one can see that the dermis is extensively infiltrated by small basophilic cells, and it's from this that the tumor develops its name. The cells mimic type B nevus cells. Now, if you remember, nevoid melanoma mimics type A nevus cells, so by definition, the nevus or the melanoma cells have vesicular nuclei with conspicuous nucleoli, whereas in small cell melanoma, the cytoplasm is much less. The nuclei are very hypochromatic and basophilic. In this field, one can see there are scattered foci of junctional activity, but there's not much in the way of pagetoid spread. And we'll look at it a bit closer. And you can see from this field how similar these cells are to type B nevus cells, except they're perhaps a bit larger. And most importantly, there's no evidence of maturation with depth. I'll just look at it at very high power, and here we can see a bit of junctional activity, but most of the lesion lies in the dermis, and as you can see, the tumor cells have very hyperchromatic nuclei with no maturation. Now, I've searched around this case a lot, and I couldn't find any mitotic activity, but I don't think that matters terribly much. It's a small biopsy, probably of a much larger lesion, and we'll have a look at this piece just in case it shows us anything different. It's probably from a much larger lesion, and I don't think it really matters too much whether we see mitoses or not. There's some more junctional activity, and if I look at high power, just in case, we'll have a quick squint around. I don't see any obvious mitoses. Now, this tumor would have stained with all of the conventional melanocytic markers, and this is particularly important because if, for example, one had a section from the tumor where there was no epidermal involvement, then one would have a major problem in coming to a definitive diagnosis. So I'm going to come out of this program, and we're going to look at a small PowerPoint presentation just to complete the case. So this is another example of small cell melanoma, And again, the diagnosis is not in doubt because we do have evidence of junctional activity. You could certainly see, even at this low power, that there's extensive epidermal involvement. And there's a slightly closer view. Here's the top of the lesion. It's largely ulcerated in this field, and it's composed of a dense infiltrate of basophilic cells, which on high power on the right, this shows you the extent of the lesion just nudging down into subcutaneous fat. And here are two more fields. And again, in the absence of junctional activity or in the absence of any immunohistochemistry, one would be hard pushed to call this necessarily a melanoma, although melanoma obviously comes into the differential diagnosis. And here's another one. This is probably even more difficult. It's a case that Eduardo Kalonji shared with me many years ago, and I don't have the epidermal component. I just have these images, which I know are of a melanoma, but I think you'd be very hard pushed to make that diagnosis on the basis of the H&E alone. So this shows you how difficult the diagnosis can be. And small cell melanoma, the only importance of the entity is that it can be so easily confused with other tumors in the absence of junctional activity or immunohistochemistry. It doesn't have any bearing whatsoever on the prognosis or behavior of the tumor. And here's another one shared with me by Eduardo, which could be easily confused for a congenital nevus. I suppose the clue is that this field is taken from the top and this field is taken from the bottom, so you can see there's absolutely no maturation. Again, immunohistochemistry confirmed the melanocytic lineage. So small cell melanoma, as I've mentioned, the importance really is in its differential diagnosis, and the tumors that it can easily be confused with include Merkel cell tumor, lymphoma. It's important not to forget about small cell metastases, say, for example, from the bronchus. It can be confused with primary cutaneous PNET or Ewing sarcoma, primary cutaneous neuroblastoma, and even rhabdomyosarcoma. And I have a few examples here just to show you. This one's easy. It's a Merkel cell tumor, and although the cells are similar to in terms of shape and size, the ghostly appearance of the nucleus is very much in keeping with a Merkel cell tumor rather than anything else. But here, for example, this is a cutaneous Ewing sarcoma that Eduardo shared with me. And if you look at the high power here, you see, I think it would be quite easy to mistake this for a small cell melanoma, but we have the CD99 expression, which helps us a lot. And here's a CD4 plus CD56 plus hematodermic neoplasm, again shared with me by Eduardo. And you can see in the H&E images that this could just as easily be a small cell melanoma, but the immunohistochemistry on the right makes the diagnosis much more easy. And lastly, I just wanted to show you this. This is a beautiful case of a ganglion neuroblastoma, which Dr. Banerjee from the Christie Hospital in Manchester shared with me. And you can see the small cells with conspicuous mitotic activity in the H&E, and then the immunohistochemistry very nicely shows neurofilament protein S100, synaptophysin, and tyrosinase. So I hope this little presentation on small cell melanoma will be of some help and has been of interest to you. Thanks very much for your attention.